All right, so here we go. All right, good morning, guys. I am Kenny Smith, also known as Kenny the Trainer from the Fit Club. Joined here today with Dr. Terry Thomas, doctor in psychology, also CEO of Life Skills Awareness. And I'm also joined with Ashley Ross, who is one of my clients and friends. I can call you my friend, right, Ashley? We're friends.
We are.
Yeah, we are. So we're going to talk to you guys a little bit about mental health and why it is important to recognize it, how to recognize it, and how to understand that mental health is not always a bad thing. So Doc, let's talk about the phrase, firstly, mental health, mental illness, mental disorder, and clarify for people out there and myself, are they the same or are they different?
They're different. Okay, so mental health is just your overall mental health. Your mental health could be in a good state or it could be in an unstable state, right? So for example, if you're feeling good and you're happy and life just seems, it's okay, you're content. Well, that's still your mental health, okay? You're still mentally, your health is good at that moment. Now, mental disorder and mental illness are, that's different than just your basic mental health, because when you have a disorder, let me keep it to where, let's say, depression. If you have depression, so depression doesn't feel good, okay? And depression looks different than it actually feels. So here's an example. Depression can be withdrawing from your normal behaviors, feeling sad, isolating yourself, being quiet, poor sleep patterns, body aches, headaches. It could be a different array of, it could present differently for different people, but for the most part, those are the commonalities, that you're just withdrawn. Maybe you don't even want to engage in life. You don't enjoy the things that you used to enjoy, so you've lost interest and pleasure in things that you would normally enjoy. Your appetite decreases, or you don't have an appetite at all. So it impacts you mentally and physically in your body. So they're different. They're different.
All right, so they definitely are different. All right,
Mm-hmm.
good. Excuse me. So let's talk about the stigma behind the word mental health or mental illness and its negative, because it does have a negative connotation to it,
Mm-hmm.
especially as it pertains to people believing that it's automatic. It automatically means you're crazy or
Mm-hmm.
you're 5150 or you got issues or whatever.
Right.
So let's talk about the stigma behind that word and how to make it to where people see that it is something that people do need to deal with, and that it doesn't always mean that you're crazy or 5150 or these negative things.
Right, right. Well, I'll just share with you myself I'm human. I'm a doctor of psychology, yes, but I'm human. I've dealt with depression. I know what that is, and it's very uncomfortable. The difference between let me share with you how it presents, and if I don't answer your question, I'll come back. I'll remember to come back.
Yeah, no, go.
Okay, so physical presentation, I'll speak for myself, was that, I couldn't sleep. I had difficulty resting and calming my brain, thoughts continuously going. There was something I wanted to say to you, and it kind of slipped my mind. So I don't want to forget your question. What was the part of it?
The stigma behind the word.
Okay, the stigma. A stigma, especially for African American people, is enormous. We African Americans tend to look at mental health as a really bad thing.
Right.
It's not. And that's why within our homes, within our core family units, a lot of times, our mothers, fathers can actually not develop, but have depression and anxiety. And so there's that stigma where, oh, you're crazy. Well, my mom has anxiety. So, but it took years for my mom to realize that that's what's wrong with me. So let me go ahead and get some help. Well, help means to go see a therapist or your primary care provider. And a lot of the times primary care providers will try to help, and they can to a point, and then they need to refer you to a psychiatrist. The word psychiatrist Nobody wants to hear that,
Right.
right? Especially within our community, not within, but without in extra, no, our community, sorry. Um, that is more accepted within Western society. Let me say that. Me being an African American clinician, I have more non-African American patients than we just don't go.
Right.
What's the problem with that? The problem is the stigma and the stereotype behind it.
Yes.
There's a stereotype that, Caucasian folks, they'll go all the time to, go get help from a therapist. Hispanic folks, they'll go too. And then there's a stereotype behind Asians that they just don't go at all. And then African Americans, we'll go only if we're forced to go. And what does that say? There's that extra stigma behind us being African American that we just won't go because of that extra twist there. We're forced to go by Child Family Services, by, the court, family law, or some other entity that's forcing us to go. So there's a stigma there. But to break that stigma, it would basically be up to the individual and them also being active in learning, researching, getting some resources, talk to somebody that who's in that line of work, or you can call anywhere, any clinic, or call a hotline to find out, hey, what do I have to do to get some help? I'm feeling depressed, I'm feeling anxious, I can't sleep, those kind of things. So there's a huge stigma in our community mainly.
Right. And I'm glad you said that because with Ashley, being an African-American woman, Ashley, now this question will be directed to you. When did you first get diagnosed with depression, and what were the signs you recognized and said, I got to go get help? Or were you forced to go get help? What was it that
It wasn't that I was forced. I was on the phone and I was calling my best friend and I was just crying every day. Like, I got to the point where I didn't want to do nothing. I would stay in my shack and braid for like 12 to 15 hours a day. I didn't want to be bothering my kids. I didn't want them around. And I called her and I'm like, I just don't want to be a mom anymore. Like, I just don't want to be here. I want to give up. I'm like, I'm tired of all of this. And she's like, well, maybe you should go see a therapist. Like, I think something is really wrong.
Mm-hmm.
And she asked me, she was like, well, if I make the appointment, will you go? And to be honest with you, that was the only reason that I went, was because she made the appointment. But after going to the first appointment and I bawled my eyes out, I was going to therapy once a week, every Tuesday. I couldn't wait until Tuesday came.
Okay.
To go to therapy.
All right. That means you had a good therapist.
And I really did. And she helped me. She helped me with so much, but it was like, as a Black woman, we're not allowed to have depression. We're not allowed to have anxiety. It's like, suck it up and move on. Get on with everything.
Right.
Yeah, like, and I mean, when I would tell people, they'd be like, you're Black. You don't have anxiety. You don't have depression.
And it's like, blah, blah, blah.
Yes, it's horrible. But it was the best decision I made.
Are you still going?
I got so much. I don't go as much because I don't have the same insurance. I have Kaiser now, and Kaiser don't cover the therapist that I was going to.
Got it.
So I don't go as much as I used to go, but well worth it.
Good. All right. So Doc, segue. What are some of the signs that one should look for in others or themselves as a sign of possible or for sure that they need to seek help?
Okay.
So whether it be a family member or themselves.
Okay. Poor appetite, loss of interest or pleasure in doing things that you normally would really enjoy. You may have some suicidal thoughts, like even though you wouldn't act upon it, it's just a thought. Oh gosh, why am I here? This, what's the use of living? Feelings of hopelessness, worthlessness, and tearing or crying, just like Ashley just stated. Poor appetite, feeling tired, lethargic, and just not wanting to be around people. And then, as previously stated, the body aches. Sometimes you have a headache. Your body may just ache, kind of like you feel like you have the flu, but they're not. The other flu symptoms aren't there, so you just don't feel like you.
Sad
So
all the time.
Gotcha.
What's that, Ashley?
I said sad all the time. I was just
Yes.
sad all the time.
And
even when I was smiling, I was sad.
Yes. And sometimes a real noticeable behavior is when your body movements change. So if people are noticing that you're moving slower than you usually move, or it could be the opposite where you're moving really fast, then those are actually signs of depression as well. Not wanting to make eye contact, just kind of being withdrawal. And it's kind of like you said, just having that face when you don't really want to have that face on. So.
Okay. All right, let's, so aside from the depression, what are some of the other types of mental health disorders?
You know what? I'm going to answer that, but before I do, I wanted to say that depression presents differently in children. Okay. Because with kids, their behaviors change.
Yes.
Sometimes they have highs where they're just uncontrollable, or they're angry, or they can't regulate their emotions, or they don't want to. Maybe they're talking too much. Maybe they're getting in trouble in school. Maybe they're acting out with just say, they're kind of. They don't know that they're depressed.
Right.
Okay. So if the child's behavior changes, and you're going to really know, because that's one of the signs of depression. If they're not playing on their phones, anything like that, and they just want to
sit there,
or they're just wild and erratic. Those are they present differently in children. So, and go back to your question. How different disorders.
That was good that you talked about the children, because my original question was how do we recognize it in others? So whether it be your spouse, or whether it be a sibling, or whether it be your kids or parents, or whatever. So that was kind of it gave us an idea of how to recognize that in other people.
I would say that for kids, at least for the children that I've worked with, a lot of it is poor emotional regulation. They're not able to regulate their emotions. So if they get upset, then their normal upset and mom or dad is disciplining them, it would be kind of pouty, whatever. And then all of a sudden it's like yelling, screaming, kicking, throwing. Those could present as depression for children. So, to get to your other question, other signs, other types of mental illnesses that impact so many of us is, I'm going to say, sometimes this is one of the bigger ones that people are seem to be getting diagnosed with a lot. I'm not sure that I necessarily agree, but it's very common right now. For some reason, it's bipolar disorder. Mm-hmm. So bipolar disorder, it can present in so many different ways, but there's a guideline for all mental health disorders that we as clinicians have to follow to diagnose. So I'll just throw out some other ones: bipolar disorder, borderline personality disorder. Let's see. For kids, there's like conduct disorders. There's adjustment disorders where kids, or even us as adults, we've dealt with something. Let's just say someone dies close to us. Well, and then we're feeling really sad. Well, that's an adjustment disorder, because you can deal with that for at least 6 months, and we'll see where you're at in 6 months. And then that you may start feeling better. So then therefore you don't have like an adjustment disorder with depression, or an adjustment disorder with anxiety. There are so many disorders. Autism disorder. There are a lot of kids being diagnosed with autism disorder. And that takes special training to work with kids like that. And sometimes they're misdiagnosed for a long time, and we don't know that that's what's going on, or mom and dad doesn't know until they reach out and get some help. Just because we see a child acting out a certain way doesn't mean that they're just bad kids. Kids are learning every day, every single day. Every time we meet someone, every time we talk to someone, we take a little bit of that person away with us. Right. So we filter things, we process it, And then it's like, okay, oh, I might be looking at Ashley and thought, oh gosh, you know, I like the color of her hair. So then that's going to make me think, oh, maybe I should do my hair that color, you know, or something she said. I know when I was in college, I had this professor, and she would always say, right, to make sure that we got the idea, the concept, right? So I say right a lot. And I realized that I actually learned that behavior from her. Yeah. So I took something about her and made it a part of me. And there's nothing wrong with that. That's okay. Because we're filtering things in and out of our life every day, and we learn until the day we die. So
I have a question too, because at one point it seemed as though kids were being diagnosed with ADHD, like left and right. Now, let's say you know, a person, an adult or kid, Ashley, whoever, goes and sees their physician.
mm-hmm.
Now, their physician says you have ADHD. Now, at that point, should one seek a second opinion from a therapist or to get a clearer diagnosis of what the doctor may have said
Well,
or diagnosed them with?
yeah, in my opinion, I'm a strong believer in okay, let me go back. If you went to your primary care provider with your child and your child was diagnosed by your primary care provider with having ADHD, I would suggest, yes, you go and see a therapist or a psychiatrist so they can do a psychiatric assessment on you, psychological psychiatric assessment, to see if your child really does meet the full criteria for ADHD. There could be a possibility, Kenny, that the child has incurred maybe some bullying at school, maybe something with mom and dad, and they have that poor impulse control going on. So therefore, remember I talked about their behavior changing?
Yeah.
There you have it. So the child's behavior is changing and it's presenting and looking like ADHD, but it may not be. There may be a trauma. They may have lost their grandmother or whoever. Something's going on, bullied at school, you know, being injured in the home, some type of trauma. We don't know. So a therapist or a psychiatrist can do a full assessment to see if your child meets the full criteria for ADHD. So that's the purpose of going to a psychologist or a therapist or a psychiatrist. But remember, the psychiatrist, we tend to start kids with going to the therapist, and so that the therapist could start working on modifying the child's behavior, doing some behavior modification stuff, and also working with the parents. And then if it doesn't settle down some, then we refer to the psychiatrist, because then the psychiatrist can prescribe, you know, some type of medication, psychotropic medication to calm the child down. But a lot of times, Kenny, it can be done in therapy with no medication.
And that's kind of what I was hoping to hear.
Yeah.
Because a lot of times people are prescribed these medications first to, you know, help them, and then they become addicted to these medications, and then it just makes the situation worse. But that's a whole nother topic, whole nother conversation.
Yeah.
And
also, one more thing. Also, it's poor parenting. Sometimes parents don't have the skills that they need to parent, to discipline their children right, or you know, they're going off of what they learned, which is what most of us do. But parenting, you know, is key. It's essential. So there's no like perfect parent in the world. I definitely wasn't a perfect parent, but I did the very best that I could, right, with what I know. And I'm hoping that it was good enough, you know. And it's just hard for sometimes to tell a parent, okay, your child is okay. It's your parenting style. Let's work on your parenting style. Because they get offended.
No one wants to hear that.
They get offended. And I understand that, but sometimes we work it, sometimes we don't.
Right. All right, Ashley. So how has, you know, this pandemic, this COVID-19, either helped you cope with your depression, or how has it triggered depressive episodes, or has it at all? Or have you been like perfectly fine? Or just talk about your experience being locked in the house. We can't hear you. Your volume's off. There you go.
I'm sorry. I said, no, I have not been perfectly fine. I'm not even gonna lie. It's been a roller coaster, up and down, depending on the day and what we're doing, especially like she said with the parenting. Because at first I thought it was something wrong with my kids. I'm like, they're not listening, they're not doing nothing. But then my therapist was like, it's not them, it's you. You're not consistent. You're not doing, like, their punishments are not consistent at all. They don't fit the crime. You get mad for something and then you're not mad for the stuff that you should be mad for. Right. So that we have been working on a lot, like me being really consistent with them. It's some days where I go upstairs and I just cry. And I'm just like, I just don't understand. Like, with me, it was, well, with us growing up, it was, oh, well, you don't do what I say, I'm just going to beat your ass. And that's it.
Right.
Mm-hmm. Well,
typical Black parenting.
We can't do, like, I can't do that with them, because it's like, at some point, they're going to get over it, and the whoopings are not going to work. And then what are you going to do?
Right.
And I would get frustrated to where I would just go upstairs and I would cry. And now I'm just like, maybe like the first couple of weeks, I was a mad woman. I'm not even gonna lie. I was a complete mad woman, and I would just scream until I got a headache. And then I had talked to my therapist, and she's like, well, even in the quarantine time, you still have to take some time for yourself. Mm-hmm. So I started, like, when I would get frustrated with the kids, I would just walk off. Or when I would literally just be sitting in here doing absolutely nothing for like 6 hours, and the time's just gone by, and I'm in a daze because I haven't even realized that the time has gone by.
Right.
And then the kids are like, well, what are we gonna eat for dinner? And I'm like, figure it out yourself. Like, my depression has really been like up and down. The past maybe 3 weeks, I've been pulling it together a lot more. Okay. But
are you on medication, if you don't mind me asking?
I actually was taking fluoxetine.
Okay.
And it helped, but I was so scared of what everybody else was saying. Like, oh, you're gonna get addicted to the medication, you're gonna be a zombie, you're gonna be this, you're gonna be that. That I was scared to take the pills every day.
Yeah, you won't get addicted to that.
No?
No, not fluoxetine, no.
Okay. See, I was nervous. They told me once I stopped taking the pills, then I'm gonna be back sad again.
No, well, no. The pills, well, that's a whole nother story, but no, you won't get addicted to fluoxetine at all. So there's a certain types of pills, categories, benzodiazepines, those kind of things that you will get addicted to, but not fluoxetine. Okay. Also, I wanted to just give you a little, share with you something that if you want to see your kids' behavior change better, improve, catch them doing good. So that's called positive reinforcement. So, my grandson is here right now, and I've got somebody in there watching him, and, I try to catch all of them. They were here yesterday, 4 of them were here yesterday, and I'm always trying to catch them doing good so that when they come over here, they know, oh, and then when I tell them they're doing something wrong, they'll stop immediately, and most oftentimes they do. So if you catch them doing good, picking up something off the floor, putting their Legos away, taking the trash out, or even peeling their banana in the living room and walking the banana over to the trash in the kitchen, that's a Yahoo moment for a kid. So anything you can catch them doing, no matter how small it is, flushing the toilet. Oh, I heard you flush the toilet, great job. Whatever. Oh, you washed your hands. Okay, good. You washed your hands? High five. There's a bunch of array of other things that I can share with you that you can do to make them really, kind of be okay and know that, oh, mom's noticing me. They want to be noticed. They want you to pay attention to them, right? So those are little things, are noticing them all day long, especially during this quarantine. And get some board games and stuff like that. We played board games last night, and we probably will play some more today. But kids love that kind of stuff. And then the Scrabble, or there's the one where you touch and you connect it over. Those are fun for kids. Mm-hmm. So those are things that I'm just giving you a little, little bitty things that maybe you can do. And guess what? That's going to make you feel better too.
Thank you.
You're welcome.
Thank you very much.
So, Doc, that goes into this next question. How can one deal with the stress under the current pandemic situation, or just in general? If someone starts to feel like actually is feeling like doesn't want to parent, I can't say that, although I'm a great dad, although I love my kids, there are days where sometimes we just need our own time. So how can one deal with, that stress being behind all day long or whatnot?
Okay, I'd say the number one thing is to have really good time management. I mean, at least try. Um, like, for example, when my grandkids were here yesterday, there was a bunch of them here and me. And so I decided, oh, I'm going to make some cookies. So the ones that wanted to make cookies, we had a little powwow. Okay, if you want to make cookies, you have to come in the kitchen. If you don't want to make cookies, then you can either watch a movie on TV or you can play a video game, and on the desktop, laptop. So after we had our little meeting and everybody decided what they wanted to do, then we separated and did our own things and got everybody set up. We're still in the same room, but essentially I'm giving them an option, a choice. So sometimes you have to give kids a choice. They're gonna have to be making choices throughout their life, right? So you might as well start now. So that's one of the things you do. You can do stuff together. If you know that you're going to, at 1 o'clock, you just wanna take the time to read a book, or you want to watch your favorite show for 45 minutes, something that you recorded, then you let the kids know that. You let your partner or your husband or your wife know, okay, from 1 to 1:45 is my time. So don't bother me, set the ground rules, okay? And close the door, do what you do. Going for a walk, you know, not even walking, dancing. I love to dance. Turn your music on and have a party with your family. Or better yet, put your earphones in and go for a walk, ride your bike, get on your skates. But at least if you start telling your kids that this is your time right now, then they're gonna know growing up, oh, between this time and this time, I can't mess with mommy or I can't mess with daddy. I have a dog. And with my dog, when I first got him, he's just a little Yorkie. And I would put him right by me where I was working out about 3 feet away. And every time he moved, I would say, stay. Nope, don't move. And I would put him right back and then I'd give him a treat. But with a child, because a child is not a dog, I've had children. I would put my children on the couch right there while I'm exercising, because I'm exercising at home. And I'll give them, something to play with. And when they interrupt me, I'll say, okay, mommy's almost done. Mommy will be done in a few minutes. And then I keep doing what I got to do. But if it's something important, you get up and you do it and you get right back to it. But you let them know, I'm not done yet.
Right.
Right? Yeah. So it's important to take that time to either, Kenny, as you know, exercise, go walk, get your body moving, and when you're having those thoughts that just keep coming back, let me say this to you. The things that happened to you in the past are in the past. That's why they call them the past. It passed you by already, right? So we're the ones that keep doing this. Hey, trauma. Hey, depression. Hey, anxiety, come back up here. I want you up here. And we put them right next to us or we put them in front of us. Okay, what are they doing for us in that moment? They're not doing anything. They're causing us hurt to relive that hurt. So instead, if we are mindful and live in the present moment, in my present moment, Kenny and Ashley, I'm talking to you. That's what I'm doing right now. If I look up and to the right, I'm looking outside and I can see my car, I can see some plants, the wind is slightly blowing. If I look to my left, I'm looking at a picture on the wall. My cup is right here and it's purple. That's right now in the present moment. Now, a lot of people have a hard time doing that, but it's essential to practice that, especially when one is feeling depressed or anxious, or you're always having these racing thoughts of things that have occurred in the past. Yes, you can focus on things in the present, write them down, but you don't have to go to bed worrying about those things. When you go to bed at night, if you're finding that you can't fall asleep, have a little notepad and a pen by your bed. I do. And I just bullet the things that are on my mind. And then once I wake up in the morning, I'm like, okay, that's what I got to do. And I find that I go to sleep a lot sooner. And then there's like little exercises that you can do when you're feeling, like Ashley, when the kids are like, really like, getting on your nerves and you're just like, I need a break from these kids. There's a technique that's called 4-7-8. And I'll show you what it is. Basically what it is taking air in for the count of 4, and then holding it for the count of 7, and then releasing it for the count of 8. So this is what it would look like. So and you do that 5 times. And I already feel it because I do it every day.
Right.
But that's something that you can even teach your kids to do. And they're like, and it becomes a family activity. And you guys do that 3, 4, 5 times a day.
Right.
So I could go on and on, but I won't.
Right. No, we appreciate that.
I'm gonna use that.
Okay.
I know you guys have a few more minutes, so I'm gonna ask these last couple of questions. Ashley, from a standpoint of someone like yourself who has not only recognized your situation, but who's also taking steps to deal with the situation, what would you say to someone who may be too afraid, too prideful, or too unsure of what to do? What would you say from someone who has dealt with it, dealing with it?
I would say get help. Go. There's no harm in going to see a therapist, even if you only go one time. It's not gonna hurt you to try.
That's right.
If you feel like something's wrong, it's never gonna hurt you to go see a therapist at least one time.
Right. Good. And we'll put Dr. Thomas, we'll put your information at the end of this video so that people can contact you if they need the help or whatnot. Okay. So really quick, Doc, I have a few steps on stress relief that I'll read and you can chime in and help people along. So number 1, pause, breathe, and notice how you feel, just like the technique you just showed. That'll help with stress relief and the crazy thoughts that sometimes you might have. It'll help just streamline those, I guess you could say, and calm those down. Number 2, take breaks from anything related to COVID-19 right now.
That's what it is. Don't look at it 2 hours before you go to bed.
Yeah. Take breaks from the news. Take breaks from your kid or your spouse or your loved ones as you need it to find your peace during your stressful times. Number 3, make time to sleep and exercise, just like you said. Those things are very, very important to ease your mind, to make sure your body is less tense and less stressed, and just feel good. Exercise is a great stress relief and great therapy for a lot of people. Number 4, reach out and stay connected. So reach out to your family, reach out to your friends, stay connected with people that gives you positive
vibes.
Positive vibes. There you go.
And support.
Yes, and support, very, very important. And last but not least, seek professional help if you're overwhelmed or just if you feel unsafe or you feel like you're going to do harm to yourself or to others or whatever. Seek professional.
That's right.
So anything you want to add before we say goodbye to everyone?
Well, don't suffer. Don't think that mental illness is something horrible, because it's not. It's like going to your regular doctor and say, hey, my throat is hurting. Well, guess what? There's a lot that goes on in your brain, and you're always thinking. We need to get the rest that we need. We need to be able to focus on how we're feeling so that we can be better parents, better spouses, better friends, and so that we can help those that need help from us as well. So the best thing you can do to make things better in your home and outside of your home is self-care. And as therapists, we sometimes forget that. We have to do self-care. Self-care is really, really important. So, but don't self-care by, doing substances or, drinking or whatever. I mean, if you got to drink, you got to drink, but not like overboard where you're stumbling or, your words are slurred. But enjoy life, whatever that means for you, and practice that social distance, wear that mask, and protect your children and protect yourself. And most importantly, protect your mental health by going to see somebody when you feel like you're not in a good spot.
Amazing. And Doc, where can they find you if they want to reach you?
You can reach me at Life Skills Awareness, and we have a website. It's www.lifeskillsawareness.org. So that's www.lifeskillsawareness.org. skillsawareness.org, or you can reach us on phone at 760-949-1200. And a little bit of information for everyone. We're currently offering a special where we can see you, well, we can do a consultation over the phone for 15 minutes, and then we can get you set up for some appointments. So there's help right now. We also have a grant where we can connect you to, we can get you in to see services with a therapist for free if you have children between the ages of 11 and 18.
Wow. Okay.
Yeah.
So take advantage, people. Ashley, any final words you'd like to say to the people or anyone out there that may be watching or listening before we go?
Just like what she said, self-care. Self-care is the best care. Take time for yourself.
And be medication compliant. Your medication.
There you say again, one more time.
Be medication compliant. Take your medication.
There you go.
I will.
All right, ladies. Well, I definitely appreciate the two of you taking your time out. I know we're a few minutes over time. I do apologize, but I definitely appreciate you guys being here with me and talking to the people. Hopefully this video gives people out there some insight on what they may be experiencing and how to deal with it and how to cope. So again, thank you guys. You guys enjoy the rest of your day. Stay safe. Wash those hands and have a great one. And I appreciate you both. Thank you.
All right, Kenny. I appreciate you too for doing this. It's a great thing.
No problem. Thank you guys.
You're a great person.
I'm trying.
I understand. You're doing it. It's working for you.
I appreciate you. All right, ladies. Have a good one. Okay. I'll talk to you guys later.
You too. Stay safe. Bye.
Bye-bye.